Hello and welcome to Health Equity Teachers video on addressing healthcare for refugees and immigrants. My name is Colleen Wong. Let's get started. And as always, here are the learning objectives for this video. Define the terms refugees, asylees, and migrants. List and describe disparities in healthcare access experienced by refugees and immigrants. List and describe health issues and factors that impact the health of refugees and immigrants. Describe how to find clinics and care centers that may help refugees and immigrant patients. Identify important aspects of the visa medical exam, domestic screening visit, and migration history for new refugees and immigrant patients. And apply culturally sensitive care and cross-cultural communication to the care of refugee and immigrant patients. The first three of these points were covered in the first video of this series, and these last three will be covered in this video. Let's go! As we discussed in the first video, accessing care can be difficult for immigrant patients, especially when legal status is at play. Even when legal status is not at play, there may be other cultural and social, economic, or social barriers in receiving care. In many instances, helping someone find a care center for a low cost or free can be really helpful. So how does one find these free or low cost clinics? Well, the first place to start would be community health centers, sometimes called federally qualified health centers. These are government-run clinics that offer services on a sliding scale. This means that sometimes there's no cost at all. There are also free clinics across the country that are not government-run, and these also provide services to people at little cost or for free. In cases of emergency departments that receive federal funding cannot turn away people for their immigration status, and most hospitals do receive federal funding, whether it be through Medicare or Medicaid or any other way. There are also low-cost clinics across the country, and an example of such is Planned Parenthood. In some states, pregnant women and children are able to get care for free, but that's not always the case in all 50 states. So something like Planned Parenthood can be helpful as well. For other services, you can always look on findhelp.org and find the specific service that would be helpful for your patient. Very quickly, I want to mention what type of screenings and healthcare all refugees get before coming to the U.S. Refugees will have undergone a visa medical screening and a domestic medical screening before their initial primary care visit, or if you're seeing them in the emergency care setting. The visa exam, which is usually done 6 months prior to migrating, includes some infectious diseases and decompensated mental illnesses. Guidelines for the initial domestic visits, you can look at these on the CDC's website, but there is some variability in their implementation. The initial domestic visit is done, as the name suggests, upon relocation to the U.S., often in a Department of Health clinic. Clinics conducting these domestic medical screenings are reimbursed through one of several mechanisms, including through the state's Medicaid program, the Refugee Medical Assistance or Refugee Cash Assistance programs, and these are part of the U.S. Department of Health and Human Services Office. Funding is also dependent on the state and the individual's immigration status. So the services and the clinics that provide these screenings may vary by state. The migration history is a key component of social history. Some important questions to consider include: did they stay at a refugee camp? For how long? What was it like there? What was their experience with healthcare like before coming to the U.S.? What was their migration to the U.S. like? Was there economic or physical strain associated with migration or life here? Are they well adjusted? What are some things that the patient enjoys doing? What are some hard things or difficult things that the patient has encountered here? And do they have economic or physical strain here in the U.S.? Be mindful of cultural barriers and use appropriate interpreter services, including gender preferences. To aid in your care of immigrant and refugee populations, the CDC has refugee country profiles, and the UNHCR also has helpful background information. In the Immigrant, Refugee, and Migrant Health Resources section of the CDC's website, there are refugee health profiles for Bhutanese, Burmese, Congolese, Iraqi, Somali, Syrian, and Central American refugees. Each profile covers some of these topics: priority health conditions, background, population movements, healthcare and conditions before arrival, medical screening of US-bound refugees, post-arrival medical screening, and some other health information as well. And we cannot talk about providing care for immigrant and refugee populations without at least mentioning culturally appropriate care. We discussed aspects of culture and how they may influence healthcare access, usage, and the care patients get. But cultural competence is complicated, it's difficult, and it's a continuous process. That being said, we can all try to practice cultural humility. Cultural humility is understanding that differences in cultures exist and working to understand the other's background and perspective, and ultimately working together. Effective care involves negotiating a wide array of determinants to achieve the common goals of healthcare. And so some determinants are listed on the screen, but this is not by any means exhaustive. There's this common framework for how you approach cultural competence called the LEARN model. So you listen with empathy and understanding of the person's perspective of the situation, elicit culturally relevant information, and explain your perception of the situation. Acknowledge the similarities and differences between your perceptions, recommend options and alternatives, and respect the person and their choices, and negotiate an agreement. The Kleinman's theory of explanatory models can help give insight into what's most important for the patient in terms of health, illness, and care. It's sometimes called the Kleinman's 8 questions, and they are: what do you think caused this problem? Why do you think this problem started, and when did it start? What do you think this problem does inside your body? How does it work? How severe is this problem? Will it have a short or long course? What kind of treatment do you think you should receive? What are the most important results you hope to receive from this treatment? What are the chief problems this illness has caused? And what do you fear most about the illness or problem? Okay, and that concludes this video on refugee and immigrant health. Thank you. Bye-bye.